This is a presentation on teen pregnancy and risk behavior of adolescents presented by Kayleen Anderson. In 2014, a total of 249,078 babies were born to women to the age of 15 to 19 years old, for a birth rate of 24.2 per 1,000 women in this age group. This is a historic low for U.S. teens and a drop of 9% from 2013. Birth rates fell 11% for women from 15 to 17 years old and 7% for women age 18 to 19 years. Although reasons for the declines are not clear, more teens may be delaying or reducing sexual activity, and more teens who are sexually active may be using birth control than in previous years. And there are still strong pregnancy prevention programs. Still, the U.S. teens pregnancy rate is substantially higher than in other Western industrialized nations, and racial, ethnic, and geographic disparities in teen birth rates persist. In 2014, national non-Hispanic Black and Hispanic teen birth rates were still more than 2 times higher than the rate of non-Hispanic white teens, and American Indian, Alaska Native teen birth rates remain more than 1.5 times higher than non-Hispanic white teen birth rate. This graph shows the geographic differences in teen birth rates that still persist, both within and across states. Among states with low overall teen birth rates, some counties still have high birth rates. Research shows that teen pregnancy increases the chances of living in poverty, low birth weights, higher infant mortality, children have health and cognitive disadvantages, and decreased opportunities for educational achievement, increased chances of dependency for public assistance and child welfare, drug and alcohol abuse, and depression. 30% of teen pregnancies end in abortion, 14% end in miscarriages, 5% are put up for adoption, which leaves 51% raised by teen mothers or grandparents. It is life-altering to be a parent. Factors that increase risk behavior are less favorable socioeconomic conditions, such as low education and low income levels of a teen's family. For example, young women living in foster care are more than twice as likely to become pregnant than those not in foster care. Single mothers working long hours that cannot be at home, and her dating behaviors also increases the behavior. Listed are some more factors that increase risk behavior, such as lack of spiritual life, alcohol or drug use, low self-esteem, and lack of future-oriented goals. By being aware of the factors that can influence teen pregnancies, parents, teens, and communities can work together to prevent and reduce teen pregnancies. The teenage birth rate fell 39% from its 1991 peak to 37.9 in 2009. The birth rates have continued to fall to record lows through 2012. Abortion rates for teenagers dropped more rapidly than birth rates, by 60% from 1990 to 2009. These are 2 graphs that show estimated pregnancy, birth, and abortion rates for teenagers 15 through 17 and 18 through 19 years old. Birth and abortion rates fell for Hispanic, non-Hispanic white, and Black teenagers 15 to 19 years through 2009. Birth rates for each group fell about 40% or more during 1991 to 2009, and data shows that each rate has continued to drop through 2012. Abortion rates fell 49 to 70% for each group during 1991 to 2009. These are graphs that show the pregnancy, birth, abortion, and fetal losses. Research suggests that by 10th grade, 44% of adolescents report having had sex. Many parents find this a difficult topic to talk about. Once they have had the birds and the bees talk, it can be tempting to consider this job done. Parents need to keep the dialogue open by addressing the developmental changes about sexual behavior age appropriate. A series of conversations about sex can begin when a child is young and continue throughout their teens. Here is a slide for tips for conversations. Prepare to hear things that might surprise you. Listen and consider teens, and even younger, talk about sex. even if not sexually active. They may be getting information from peers, which may not be accurate. As a parent, if you don't know something, say so. Embarrassment is a common barrier to have conversations about sex. Consider your values. Teens are interested about what parents think about sex, even if they don't ask. Their values mirror their parents'. Their point of view may not be the same. Here is a graph that shows the United States, along with other countries, on the abortion and birth rate of 1,000 women ages 15 to 19. Use naturally occurring moments to start discussions. Scenes in movies, lyrics in music, celebrity scandals, pictures in magazines are great conversation starters. Ask their opinions. Avoid judgment. Let teens express their opinions in order to have a two-way conversation. Use facts about risks like sexually transmitted diseases. Start early. The best time for parents to talk to children is before their children needs the information, not after. Prenatal care screens for medical problems in both mother and baby, monitors the baby's growth, and deals quickly with any complications that arise. Prenatal vitamins with folic acid, ideally taken before getting pregnant, are essential in helping prevent certain birth defects, such as neural tube defects. Pregnant teens have a higher risk of getting high blood pressure, called pregnancy-induced hypertension, than pregnant women in their 20s and 30s. Medical risks and realities. Stay away from alcohol, drugs, and cigarettes. These harm the growing fetus. Ask for emotional support. Motherhood brings emotional and practical challenges, especially teens still in school. Reach out to family and friends and the baby's father for support. To improve the life opportunities of adolescents facing significant health disparities and to have the greatest impact on overall U.S. teen birth rates, the Center of Disease Control uses data to inform and direct interventions and resources to areas with the greatest need. U.S. Department of Human and Health Services has 39 programs listed on their website. These are 2 evidence-based teen pregnancy prevention programs. The All For You, behaviors associated with increased risk of HIV and other sexually transmitted diseases. The And Unplanned Pregnancy program has 2 primary instructional components, a skill-based HIV and STD and pregnancy prevention curriculum and service, learning visits in the community that are integrated and delivered. The next, the Assisting in Rehabilitating Kids, the ARC program, is an intervention for substance-dependent youth designed to increase abstinence and safer sex practices and reduce risky sex behaviors. The intervention is delivered in small groups after the participants' initial detoxification in their drug treatment facilities. Delivery methods include games, group discussion, lectures, practice, and training. ARC is adapted from the Becoming a Responsible Teen BART program. The Carrera Adolescent Pregnancy Prevention Program is a 7-year program which relies on a holistic youth development approach. The program recruits disadvantaged boys and girls ages 10 to 12 years old and follows them through high school and beyond. This program consists of 7 required components and is delivered by trained and certified staff. The program may be integrated into the school day or implemented after school and in community-based locations. Be proud, be responsible. This is a new program. It is a 5-hour intervention delivered in 6 50-minute modules designed to modify behaviors and build knowledge, understanding, and a sense of responsibility regarding STD, HIV, risk behavior in vulnerable youth. The intervention aims to affect knowledge, beliefs, and intentions related to condom use and sexual behaviors, such as initiation and frequency of intercourse. Be proud, be responsible, be protective aims to reduce unprotected sex among sexually active, pregnant, and parenting teens by affecting knowledge, beliefs, and intentions related to condom use and sexual behaviors. It also addresses the impact of HIV and AIDS on pregnant women and their children, the prevention of disease during pregnancy and the postpartum period, and special concerns of young mothers. The program consists of 8 60-minute modules focusing on behavioral attitudes, expectations, negotiation, and problem-solving skills, self-efficacy, and feelings of maternal protectiveness. Another intervention program is the Federally Healthy START program. The objective of this program is to reduce primary and repeat teen pregnancies in disadvantaged communities. They target teenagers between 10 and 19 years old. The results of this program, the first-time teen pregnancies dropped while the repeat teen births increased.